put the spotlight then on Narayana Health because the company's come out with their earnings for the quarter gone by. The stock is seeing muted moves at this point in time. Let's bring on board Sandhya J, who is the Group Chief Financial Officer at Narayana Health, to join us on the show to talk about the earnings for the quarter gone by. A very good morning to you. Thank you so much for joining us on ET Now. And let's firstly talk about your earnings for the quarter gone by, because if you look at the numbers, yes, there is a growth coming in for the revenues as well as your profit growth. But the profit growth is pretty slower when you compare it as for your historical growth. And your margins, there's a decline in your margins. If you could help us understand exactly what transpired.
Good morning. Thank you for having me here. So let's start with the picture on revenue. If you see our revenue growth, there are two parts to that story. We had a significant international footprint, and most of our international patients used to come from Bangladesh. And with the volatility and the political turmoil that the country went through, we had a significant decline in our international business. So Bangladesh almost halved for us in terms of the contribution to the top line. And what we are very positive about is the way the top line in the domestic business has picked up. So with hardly any capacity addition, as you are aware that we've been very conservative on capacity, we've been able to grow the domestic business by 18.7%. And that really is very healthy because this comes from a throughput improvement within the same facilities and also our ability to execute in the local market. So that's the picture on revenue. Now, as far as the margins are concerned, we still had a little bit of impact which was coming in from Cayman. So India has grown margins versus same quarter last year, and India margins have been on a steady improvement path, and you've been able to see that on a consistent basis. The decline has come from Cayman, which was anticipated because the new facility has gone live. And obviously, the costs are all there and the revenue is not coming in. But the positive part of that is that it is coming up online much faster than we originally anticipated. So we're going to see a good recovery in terms of Cayman revenue and margins starting from Q4 itself.
All right. Hi, Sandhya. This is Shrishti also joining in. But also give us a sense on the patient footfall as well, because sequentially when we see then for India, that's been down around 12%. Help us with the reason for that. Is it because of a seasonal impact? And also give us a sense on the margins as well. They were down too for the India business, but what's the outlook?
Sure. So as far as patient footfall is concerned, there is this quarter on quarter and year on year. Now, quarter on quarter, yes, there is a dip in the patient footfall, but that happens across the board because Q3 is seasonally a weak quarter for the healthcare industry. We normally see a dip in Q3 because of festive seasons, a lot of holidays, etc. The other aspect is that there is a significant dip because of Bangladesh volumes. Now, for us, Bangladesh was a lower realization customer segment. Because of a lot of the people who come from Bangladesh also were expect a certain certain rationalized pricing, and therefore, while we've seen volume dip in Bangladesh, we've seen a compensatory volume increase in India, and we've seen a better realization growth. Now that's one part of the footfall story. The other aspect is like year on year, if you see our footfall, we have grown versus last year, despite the fall we have seen from Bangladesh. So we are still very happy with the way footfalls have come through.
Interesting. Sandhya, I wanted to understand what kind of capex then are you looking at, say, in the next few quarters, and what would be the sort of pipeline like when it comes to business?
Sure. Just before I answer that question, there was a second part to the question which I missed in the earlier question, which is about the margin decline. So if you see the India hospital business per se, the margin has expanded year on year. And Cayman, there is a dip, but it will come back like we've always guided. The overall dilution we are seeing is because of the investments we are making in the integrated care business, which is our new business line where we are setting up clinics and insurance. So that is the reason why you are seeing an overall movement in the margins. So that's just something I wanted to clarify. As far as capex is concerned, we are entering a capex growth phase right now. We have committed to significant capacity addition over the next 3 to 4 years. If you see our latest investor deck, we have announced at least 1,400 beds that we are going to add in the next 3 to 4 years, mostly greenfield, but some brownfield, some expansion, some also leased capacity. And we are looking at more avenues to grow. Our capex focus, like we've always said, is in our flagship locations, Bangalore, Kolkata, and Raipur. And as and when we have more opportunities that we are going to embark on, we will keep sharing.
Interesting. Sandhya, so good to have you on the show. Thank you so much for your time today.
Thank you.